This is Living Healthy with Jackie Bell, the show with the information on health that you need to know from people you can trust. Brought to you by the woman in you.
Hi, welcome to Living Healthy. I'm your host, Jackie Bell. Today's show is called Intelligent Wellness, and our guest is Dr. Jessica Daniels of BodyEclectic.com. Welcome, Jessica.
Thank you for having me.
Dr. Daniels has been a chiropractor and holistic practitioner for over 15 years. She uses alternative therapies and modalities to support and empower patients to create well-being in their lives. And tonight we will discuss magnetic resonance stimulation as an effective therapy for fibromyalgia, depression, seasonal affective disorder, osteoporosis, sleep disorders, and much more. So Jessica, we'd like to get to know you a little bit. Tell us how you became a chiropractor and what had what inspired you to move into some of the therapeutic modalities that you use now?
Well, I actually began my professional career in the corporate world, and after a car accident I had severe migraines that lasted for over a year, and a lot of jaw issues that I didn't understand were part of the problem. And it was a friend who sent me to a chiropractor, and then I finally got relief from the headaches. So it mulled around in the back of my mind for a number of years, and then later I went back to chiropractic school. And at that time, it was before the information age with internet and whatnot, and I had a lot of other underlying health issues that didn't make sense and couldn't get answers to. Turned out I had chronic Lyme disease for many years that had gone undiagnosed. And I also had had some chemical poisoning. So it started out as something that I had a passion for trying to figure out the physical body, and I realized we're much more than just a physical body. It was when I started my journey to really incorporate the physical, the mental, the emotional, and even the spiritual, because it encompassed all things in my own personal journey.
So what exactly is intelligent wellness? That's the name of our show today, and why did you choose that?
Well, I actually borrowed that name, but intelligent wellness is used by the company that created the magnetic resonance device that I use. And they refer to intelligent wellness because everyone today is trying to get into the area where we can monitor and regulate different things in the body for improved health. So intelligent wellness is really, it's no longer the wave of the future, it's the wave of the now, because we have techniques and technologies that can take us so much further than what they used to.
And that means, well, let's get into magnetic field deficiency syndrome and explain that, because it seems that intelligent wellness has more to do with the nervous system or energetic systems of our bodies.
Yes, and actually with intelligent wellness, one of the things that we're able to do now is to use different body systems as biofeedback. So in addition to the traditional biofeedback that most of us are aware of, this particular system actually uses heart rate variability as one of the things that it monitors and then adjusts the signal. So then we can look at ways to improve our health through improving our heart rate variability. So magnetic resonance is also referred to as pulsed electromagnetic frequencies. And PEMF therapies have been around for a very long time, but now the applications are much better than what they used to be. So we're using them for things, initially it was used for bone healing and for improving bone density, a little bit for depression, and now we found that it impacts our health in so many additional ways.
So let's just slow down a little bit. Let's talk about what is biofeedback. And I think a lot of people really don't know that. Most people are used to going traditional medicine and they have no idea what even biofeedback is.
So biofeedback is basically using information from the body as a way to adjust what we do so that we can then change the way our body is behaving or the way our thoughts are behaving. So it's a feedback system that allows us to make changes. And
so you said that you like to use heart rate variability. How does that work? The variability in the heart rate is normal. It's normal to have variability.
It's normal to have variability, but what research has shown is that when people have, it's used as a very reliable predictor for our overall health as well as for our cardiovascular health. And what they found through the research is that when people suffer from things like depression or heart disease, congestive heart failure, things like diabetic neuropathies, anything related to the cardiovascular system, they tend to have lower heart rate variability. So when we're able to do things that improve heart rate variability, then our health also improves at the same time. So we're better able to deal with stress, we're better able to heal and repair tissues in the body.
So the heart rate variability, we're looking at the pulse of the heart and the timing between the pulses, and
Yes.
that should vary.
Yes.
And that's why it's called the heart rate variability.
Right.
And when it becomes regular and certain patterns, then it's not variable. And is that associated with certain diseases? Is that why
Yes.
you're able to monitor that? Okay.
Yes, and also the other thing that's affected by heart rate variability is when we are in the healthier ranges, then we also have the ability to balance the autonomic nervous system.
Okay.
The sympathetic nervous system is the part that is usually referred to as fight or flight. So it's the one that is the excitatory. And then the other half of the autonomic is the parasympathetic. And that tends to be, some people refer to it as the rest and digest because it's the more calming one. And what happens when we have a stress response in the body is that it often over-excites the sympathetic nervous system, and then we have complications because of it. So if we keep our heart rate variability in the healthier ranges, then we have the ability to keep that system more in balance.
Because sometimes naturally, if you're crossing the street and you didn't look and you see a bus coming, you need to have that
Exactly.
fight or flight mode to get back on the sidewalk, and so, but afterwards you need your body to get out of that fight or flight mode so you can walk calmly across the street.
Exactly, and some people get stuck in the fight or flight and they run too much adrenaline, which then depletes other systems in the body.
And some things that can get us stuck in fight or flight might be emotional stress.
It could be on any level. It could be emotional, it could be mental, it could be physical.
Even certain foods.
Exactly.
Okay.
Diet and exercise and lack of hydration, people who don't drink water, same thing. All of those things, you know, have an adverse effect on the body.
Okay. So with that said, how does this magnetic field deficiency, well, explain what the magnetic field deficiency syndrome is, and then how it affects and causes different types of syndromes in the body, sleep disorders and so forth.
Sure. So I'm going to go back in history a little bit. Where we first started to be aware of it was when they sent the first Russian cosmonaut into space. And what happened was he came back and he'd had atrophy of his muscles, he'd had loss of bone density, he had disoriented proprioception, severe depression, and his cellular metabolism had been affected.
And what is proprioception?
Being able to judge different things, like his responses were not appropriate for what was happening around him.
So is that like a coordination between the brain and the rest
Yes,
of the body?
Yes, exactly. So it's a breakdown in communication in the nervous system.
Okay.
And initially they thought that was because he'd been out of the gravitational field of the Earth. And what they learned subsequently was that it was because he'd been removed from the magnetic field that's produced and emanated by the Earth. So now it's interesting to find that in all of the spacesuits and in the spaceships, they have devices that create Earth frequencies that mimic the magnetic field of the Earth. And that's how they can take these trips into space and come back unaffected, or in terms of their health.
Wow. So magnetic field deficiency syndrome is a lack of...
Yes.
So could someone like you and me have that?
Anyone can have it, and part of it is that we've had a few ways that occurs. One is we spend a lot more time indoors than older generations used to. So we're away from the Earth. Plus we also have a lot of man-made materials. So most people wear shoes that have insulating materials on the sole, not conducting. So that's part of what's happened. And then the other issue today is that we have so many technologies that create frequencies that are above and beyond what we're used to, what our bodies are designed to handle. So things like microwaves and cell phones and computer technology all emit a certain frequency and intensity that's actually above what our bodies typically can handle. So it excites that sympathetic part of our nervous system, and then that gets us out of balance. So if we don't recharge with the Earth's magnetic frequency, then we can result in anything from agitation all the way up to severe illness.
So I've heard that, living near the transformers, the electric transformers from the telephone, from the wiring, or the electronics from the electronic poles, the transformers, and then the electricity is dispersed out. Residents around those areas, because of the electromagnetic frequencies, tend to have diseases like leukemia and so forth. And so EMFs, electromagnetic frequencies, have become something that we've been aware about even in our own homes.
Exactly.
Sleeping near outlets and having the clock right next to your head and things like that. And so you're saying that to counterbalance these things, besides taking a few precautions, would be to actually do some kind of therapy that can reinstall or replenish this deficiency of the normal, natural resonance that the earth pulses out. So are we as dependent on that as, say, the sunshine to a certain degree?
Well, the research has shown that if you're out of the field for more than a few hours, you start to see bone density decreases, muscles atrophy, depression can set in. So depending on the severity of what you've been deprived of or what is depleted in your body, you can have more severe reactions. And so of course it's all an individual thing. There are some people who will use devices that are in pendants and bracelets that tend to block some of the harmful EMFs. And then there's the pulsed electromagnetic frequency therapies, which are sometimes called PEMF therapy or magnetic resonance stimulation.
So why don't you talk to us a little bit about this magnetic resonance stimulation that you obviously do in your office, what kind of devices you use and how you've seen it help your patients with different kind of disorders.
Well, there are a number of devices on the market. The one that I use in my office I'm obviously particularly fond of. But one of the things that it's been very helpful for is some of the conditions that relate back to magnetic deficiency syndrome. In fact, in parts of Europe and in parts of Asia, they don't have fibromyalgia and they don't have chronic fatigue syndrome. They have magnetic deficiency syndrome, magnetic field deficiency syndrome. So they treat it with magnetic frequencies that are pulsed, and all of the symptoms go away. So in my own practice, I've used it just for well-being. For people who don't have particular health complaints still use it when they come in for a session, and then I have people who have all sorts of conditions that we're just doing it as a way to recharge their body, to oxygenate their cells, to give them a better starting place, get things back to balance.
So it's kind of like nutrition gives you the right kind of nutrients to fire away, building cells and doing metabolic processes. But if you're deficient in this natural electromagnetic frequency, then that could be a contributing factor as well.
Yes, and in fact, some of the things that the PEMFs do for the body is one basic thing is it increases the cell membrane potential. So what happens then is it allows the body to bring blood to bring oxygen to the cell more effectively. So it oxygenates the cells, it improves circulation. It also allows the body to detoxify. So when we detoxify, it helps to eliminate some of the inflammatory process in the body, because a lot of inflammation is caused by toxins that have built up, and it's the body's response to that. So when we use these therapies, it does all of those things. It helps to relax muscles. It can also act as an analgesic, so it decreases pain levels for certain things. So there are really very few people who wouldn't benefit from it. So even if you think that you're healthy, it's still a wonderful thing to oxygenate your cells.
Yeah, it's just like if you think you're healthy, it's good to exercise.
Exactly. And it also, one of the other things it does when you talk about nutrition is it allows the body to utilize nutrients better.
Yeah.
So it helps with absorption and utilization. So even the food that we're taking in will nourish our cells better if we're using therapies like the pulsed electromagnets.
So it improves the electronics within your system from the cellular level to the throughout your neurology, and that of course affects everything else.
Absolutely. Another thing that it helps with is when we look at the cells in the body, they've estimated we have about 70 trillion cells, and in each cell there's a mitochondria, which is the part of the cell that produces energy in the form of ATP. So when we do pulsed electromagnetic frequencies, what they find is that by the way it affects the cell, it actually acts as a catalyst for us to produce more ATP. So it makes the cells regenerate faster.
And that's actually the opposite of what happens to cancer cells, or why cancer cells are produced, because there's a lack of oxygen, there's a lack of oxygenated-driven ATP, energy produced in the cell, and so that ultimately produces
Yes, and in fact,
cells.
it's one of the few therapies that's allowed as a supportive therapy in this country when you're going through chemo and radiation and an active cancer process, because it actually is very beneficial. It doesn't cure or treat the cancer in any way, but it helps to boost the immune function, oxygenate the cells, and improve the cellular health, which then in turn can do all sorts of things.
Now, some of us are probably thinking that we have to go through a chamber, you know,
like a hyperbaric chamber.
Yeah, like a hyperbaric chamber, or CAT scan or something like that. But what's it like to have a treatment done? What kind of modality do you use in your office?
Well, there are different types on the market. Some of them use coils that you place on the body. They tend to be in ranges that are much higher than the intensity and frequency that is emanated from the earth. The one that I use is actually a very comfortable mat that you lie on, and it's a very gentle, relaxing feeling. Some people feel a little bit of warmth or a little bit of a tingly pulsation, and I'd say the average person doesn't feel a lot. I also have a light and sound therapy that runs in synchronization with the mat, and the advantage to that is for a lot of people they find it very soothing. It does a lot of brain entrainment, and there are two settings in the beta and the alpha frequencies that will do stimulation of brain function, and then we have theta and delta, which actually are the relaxation brain waves. So we can run the light therapy simultaneous with the mat, and most people really find it to be a very pleasant experience.
That sounds like something you could use for animals, putting them on the
They
mat
have
as well,
systems that are designed specifically for animals, and a lot of people use the ones that, you know, they can interchange it between people and their pets.
So who would benefit from this? I mean, we've talked, it seems to be a wide range, but in particular, where do you see the drastic results? So some of the people in the audience might have, you know, certain kinds of symptoms, and, you know, traditionally if they go to their doctor, they're usually just given drugs, or they're not, you know, the issue isn't resolved. Where have you found this to be successful? What kind of cases?
It's extremely effective with fibromyalgia, also with depression. It's been very helpful with seasonal affective disorder, and that's kind of a twofold thing. There are a lot of experts who believe that that's partially from the lack of sunshine during the winter months, so we don't get pineal gland stimulation.
Yeah.
And I think that's truly a part of it, but then there are also others that respond very well to PEMF therapy, and that's because there's the belief, as I said earlier, even in other countries, they don't call it SAD like we do here because they think that it's magnetic field deficiency syndrome. So people with SAD as well as depression usually benefit very quickly. I've had cases with inflammation and pain where the symptoms go away very quickly. I was one of those cases that had sleep issues my entire life from very early in childhood. And I was also a miraculous case with this device because I was one of the lucky ones that after 5 sessions I started sleeping through the night for the first time in, I couldn't even tell you how many years.
Wow.
So with sleep disorders it's the same thing. Sometimes it's because our body can't reset the circadian rhythms or can't get into balance, and then it becomes a vicious cycle because we don't produce some of the hormones that are necessary because we're not sleeping.
Yeah, I was just going to say a lot of women blame it on, menopause.
Well, I've had a fair number of women who thought that it was menopause, and when they use this device have found that for whatever reason their bodies are responding better. Their immune function is better, and the oxygenation probably has a lot to do with it too, but the sleep issues go away.
So typically, how long do you stay on the mat?
You know, It's really designed to use on a daily basis. I use it in my office anytime someone comes in for a session, unless they would choose not to, which hasn't happened yet. So the way I look at it is every time you're oxygenating and detoxifying the body, you've done some benefit, even if you only do it one time. But in the perfect world, people would have a system like this that they use at home on a daily basis. And in many countries, that's the case. And ideally, you want to do either 8 minutes, 16 minutes, or 24 minutes twice a day. So 8 minutes twice a day is probably the minimum if you want the ultimate response in your body.
Do they make devices that are better, more typical for home use as opposed to professional use?
Yes, they do.
Yeah,
yes.
So it would be simpler to use and so forth. Tell us how you incorporate that into your practice, because it's not just the only thing that you use in your practice. It's something that you use to lay a foundation and maybe use it strategically within a protocol. What other modalities do you have in your practice, and how do you incorporate this into other modalities?
Well, I try to look at each individual person and what they're coming in for, plus what I see beyond that, because as I said with myself, everyone's a composite of the emotional, the mental, the physical, and the spiritual. So sometimes they're coming in with what they think is a physical issue when there's really another component. So there are different modalities and therapies that we'll use depending on who the individual person is. I have infrared therapy that I use for circulation and inflammation. It also does intersegmental tractioning, which is great for spinal decompression. I have a laser device which does a number of different things for inflammation and pain and some other things beyond that. I have vibration therapy that I use with some. The adjusting that I do is generally very low force instrument adjusting. I don't do osseous adjusting anymore. I find most of the people that I work with like a gentler, and it's as effective, but they like a gentler approach. So we combine different things. And when I'm doing the magnetic resonance, I do that almost every session. There are very few people that haven't used it, and it might be the one or two that have a contraindication. Otherwise, usually if I were to forget it, they remind me. So we incorporate that because I think that it just accelerates everything else that they're doing in their lives to work toward a more optimal picture of health.
And how long have you had it in your practice?
A little under 2 years.
So have you seen a difference from before, and before you had it, maybe you had some of the same patients and then using it over the past 2 years?
Yes.
Have you noticed a difference in
Absolutely.
acceleration in healing or well-being as far as emotionally and so forth?
I've seen both. I've seen a lot of them that really, they identify it as they're less depressed, they're less moody, they sleep better. And then I also have some that are more physical symptoms that they've noticed have improved. The Lyme disease patients have all done really well, responded very quickly. I would say also some of the folks with allergies. I used to suffer from a lot of allergies, and they're very non-existent now except for one or two things.
And what about children? Do you find that children maybe who are hyperactive or just are struggling in different ways, whether it's
anxiety disorder, a lot of them.
Yeah, anxiety disorder or attention disorder or anything along that way. Do you find that it helps the children?
Definitely, and I think it's especially helpful if they're willing to use the light therapy, because then you get the neurological stimulation to the brain through the light as well as what they're getting on the mat itself. So it just accelerates everything that happens for them.
So it's more of a balancing and replenishing the electronic communication and then nourishing
and like recharging
balancing
our whole body. It's a body recharge.
Yeah, that's interesting. So Jessica, you've been in medicine, studying medicine for well over 15 years, and what you brought here to the South Coast is used widely in Europe, everything from the infrared and the lasers and now the magnetic field therapies and so forth. Where do you see the trend in medicine going? And I'm talking not just here in the United States, but actually globally. How do you see modern medicine in the next 5, 10, 15 years in dealing with the issues that we face, a lot of the things that we talked about, whether it's sleep disorders or neurological dysfunctions and inflammatory conditions. Because it seems like, you know, you're not using anything that's traditional here in the United States, although it's used much widely there. So could you just comment on that for us?
Well, I think that is the trend that we have already moved into. Traditional things are not enough because we were compartmentalizing too many conditions and body parts, and it just doesn't work. We're not little isolated parts of a body, we're a whole being. So I think that even in traditional medicine, you're seeing more and more practitioners who are starting to incorporate alternative in with traditional, because it isn't usually a simple, it's not one simple thing that's going to take their health back to where they need it to be. And I think that, you know, we're going to find more and more changes as we start to see the effects of technology on our bodies. We have to start to address things. No one's going to give up technology, or we don't want to.
Right.
So we have to look at things that we can do to now balance our bodies so that we can continue going forward with our health while we have the advantage of other things.
Right. So how would someone incorporate these modalities if they were struggling with, you know, say maybe they're on a few prescriptions or they're seeing their doctor regularly? This is usually out of pocket, so it's kind of, a lot of people will shy away from anything that isn't covered by insurance.
Right.
And so it seems like we need to actually, you know, be willing to speak out and be an advocate for ourselves and take responsibility. Do you find a resistance at all from people, or do you find that more and more patients are looking for, are so desperate for relief that they're willing to try something new?
I think that's often the case. They've tried so many other things and they've hit that, you know, that wall where they have to start looking beyond and have to start being their own advocate. So I do think that more and more people will speak up and demand that we get better health care and better options. But I also think that it's a time when we have more information available to start putting together some of our own desires for our health and well-being. We don't have to just take one answer, we can ask for options.
Right. Well, you know, you've really brought to the table for us some alternative therapies that are used around the world and really not well known here. And even if we took this information to our physician, there's a good chance that they might not have heard about it or know whether it's going to help us or not. And I really appreciate your coming here and spending time with us describing all this. It's really important.
Thank you, Jackie.
My name is Jackie Bell. You've been watching Living Healthy. Today our guest has been Dr. Jessica Daniels. If you'd like to know more about the work of Dr. Jessica Daniels, you can go to her website, bodyeclectic.com. Her phone number is 508-636-4111, and Dr. Jessica practices in Westport, Massachusetts. Thank you for joining us. We'll see you again next time.